Today, we enter the silent world beneath the teeth, the jaw bones. 5 different diseases hide here, each leaving a unique mark. Some are quiet and slow, others aggressive and destructive. Your mission: learn to recognize them like a true dental detective. First, fibrous dysplasia. A genetic mutation replaces normal bone with fibrous tissue. The swelling is painless, slowly changing facial shape. Radiographs show a classic ground glass appearance. Treatment is usually observation unless there is deformity. Then, surgery may be needed. And remember, avoid radiation, as it may lead to malignant change. Next, osteomyelitis, the painful invader. A bacterial infection enters bone after trauma, extraction, or systemic weakness. Symptoms: severe deep pain, swelling, pus, fever, possible fistulas. Radiographically, it appears moth-eaten with sequestrum. Management includes long-term antibiotics and surgical debridement. Next, Osteoradionecrosis. After radiation therapy, bone loses blood supply, becomes brittle, and may die. Exposed painful bone that does not heal. Diagnosis is clinical and radiographic. Treatment includes gentle cleansing, antibiotics, and hyperbaric oxygen. Surgery only if needed. Prevention is key. Avoid trauma after radiation. Fourth, osteoporosis of the jaw, the silent bone thief. Bone density decreases with age or hormonal imbalance, especially in postmenopausal women. Often asymptomatic, but may cause loose teeth or ridge resorption. Diagnosis via DEXA scan. Treatment: vitamin D, calcium, and caution with bisphosphonates due to the risk of osteonecrosis. Finally, Osteosarcoma, the aggressive villain. Rapid painful swelling, possible numbness, loose teeth. Radiographs show a sunburst pattern. Treatment requires surgical resection and chemotherapy. Early detection can save life. You are the guardian of the mandible and maxilla. Each pattern, each sign, each story guides you to the right diagnosis. Fibrous dysplasia. Painless swelling. Ground glass appearance. Surgery if needed. Avoid radiation. Osteomyelitis. Severe pain, fever, pus. Moth-eaten plus sequestrum. Osteoradionecrosis. Exposed bone after radiation. Bone necrosis, infection. Hyperbaric oxygen plus conservative care. Osteoporosis. Silent bone loss in elderly. Thin cortical bone. Calcium plus vitamin D. Avoid trauma with bisphosphonates due to the risk of osteonecrosis. Osteosarcoma. Rapid painful swelling. Sunburst radiograph. Surgery plus chemotherapy. Fibrous dysplasia equals painless swelling plus ground glass appearance. Osteomyelitis equals pain plus pus plus moth-eaten bone. Osteoradionecrosis equals exposed bone after radiation. Osteoporosis equals silent bone loss in elderly. Osteosarcoma equals rapid swelling plus sunburst pattern. 1. Ground glass radiographic appearance suggests: A. Osteosarcoma. B. Fibrous dysplasia. C. Osteomyelitis. D. Osteoporosis. Correct answer: B. 2. Moth-eaten bone with sequestrum indicates: A. Fibrous dysplasia. B. Osteomyelitis. C. Osteoradionecrosis. D. Paget's disease. Correct answer: B. 3. sunburst appearance is seen in A. Osteosarcoma, B. Osteoporosis, C. Fibrous dysplasia, D. Cementoma. Correct answer, A. 4. Often painless at early stage. A. Osteomyelitis, B. Osteosarcoma, C. Fibrous dysplasia, D. MRONJ. Correct answer, C. 5. Hyperbaric oxygen is used in treatment of A. Osteoporosis, B. Osteoradionecrosis, C. Osteosarcoma, D. Fibrous dysplasia. Correct answer, B.